The way you approach questions is first seize every opportunity to show what you know about certain topics. We should have the mindset of showing the interviewer your hard work. If you can, have the mindset of looking forward to each question. A lot of the interviews between medical schools will usually share similarities and be predictable. This is why you should always prepare and practice on what they can potentially ask you, such as talking about what you've learned from your work experience or a recent subject that you've learned related to medicine. Try to think about what the interviewer might be thinking and why they're asking you these specific questions. What is it that they're trying to get out from you? We will go over this later in the course. Do take your time to process the information, such as the questions that you've been asked, and think about it carefully. Aim for about no more than 5 seconds, and then answer the question in a structured way. Again, we will go over this later for each topic. If you don't understand the question, it's perfectly okay to ask the interviewer to repeat themselves and gain better clarification. It's better to answer what they're looking for instead of guessing what they want to know. Focus on answering what they're looking for instead of going around the question. This is an amateur mistake. Try to answer questions as honestly as you can while backing up your answer with evidence and knowledge that you know. Worst case scenario is you don't know what you're being asked about. Just be honest and admit it. The worst thing that you can do is answer something completely different to what you've been asked, and therefore you've wasted your own time and the interview's time, which is precious. Of course, don't lie or sound arrogant in your interview. Trust me, interviewers will know and they won't like this. Let's talk a little bit about timing for each question. So this is really dependent on whether you have a panel interview or multiple mini interviews, MMIs. In panel interviews, you tend to answer the questions and work with the flow, and it's dependent on the interviewers, as you don't want to sound too robotic or too rehearsed. Whereas in MMIs, you have a more structured approach, and it's timed in a specific structure. For example, you have 6 minutes to answer 3 questions being asked with no follow-up questions, which means you have 2 minutes per question. Therefore, it is important to be aware of this before entering the interview of your specific medical school. But as a general rule, give around 2 to 3 minutes per question and only answer information that correlates to what's being asked. If the question is testing how much you know about a certain topic, such as challenges within the NHS, try to answer things in as much detail as possible under those 2 to 3 minutes, and try to include recent facts and figures to impress the interviewer. Give it your best go. Sometimes the interviewer will guide you into the right answer, or direct you back on track if you go off course on a specific question. As an interviewer, we aim to try and help you get as many points as possible for your interview. In worst case scenarios, you can mention a few trusted or evidence-based resources where you would look up the information if you lack the information on the chosen topic at that time. In medical school interviews, it is common practice to ask you questions on your attributes, such as empathy, leadership, teamwork, and communication. When you're answering these questions, it's important to include anecdotes or stories that you can tell based on your experience to show how you acquired these attributes already